How can I manage and treat the symptoms of dementia? Okay, so just before answering this question, just to add a couple of sentences to what my friend here answered about the symptoms of dementia. So normally, the progressive loss of memory happens in a retrograde direction. That is, the older memories will be intact, and the recent memory deficits are the ones that appear in the beginning. And as the disease progresses, more and more, the older memories also start getting affected. So that's just one line that I wanted to add. Now I can. So the third question is, how can I manage and treat the symptoms of dementia? So basically, dementia will have, let's say, two sets of symptoms. One is forgetfulness, and the other is, behavioral and psychological symptoms due to dementia. So we have medicines to, for forgetfulness, we have medicines to slow down the, progression of dementia. We don't have medicines that will completely stop the progression of dementia. We don't have medicines to cure dementia, but we have medicines to slow down the, progression of dementia. So those medicines we have to start for the patient. And these medicines are called, there are two sets of medicines. One is the cholinesterase inhibitors. So they are the commonest, that is like donepezil, rivastigmine, etc., etc. And then there is another medicine which is called memantine, which works in a slightly different, through a different mechanism, and that is useful in moderate to severe dementia. So the you know so we have just a limited set of medicines to slow down the progression of dementia. That is one part that we use. Second is, anyone who develops dementia, they can also develop depression, they can also develop anger outbursts, they can develop some psychotic symptoms and delusions, feeling that someone is trying to harm them, or someone is trying to steal their things. They start accusing their family members that, their own family members are stealing, let's say, 5 rupees from them, 10 rupees from them, something like very silly kind of thing, but they really believe in those things, and because of that they become angry, and they may start beating others, etc., because they have difficulty in controlling their own behavior also as dementia starts. So we have medicines for these behavioral symptoms also. Let's say if someone is going into depression, so we use antidepressants. If someone has developed delusions, then we use antipsychotics. A lot of them will have, as Dr. Nagaraj said, sleep wake cycle reversal. So they sort of sleep a long time during the day, and they have disturbed sleep in the night. So we can try to use some sedatives to improve their sleep. But in general, so yeah, like when we use benzodiazepines for sleep, that can worsen forgetfulness also. So there are certain things that we have to keep in mind, and try to treat these symptoms.
Just to add to the point, like what treatments are available. Um, to treat we currently we have medicines to treat the symptoms, but there are like two drugs that were recently approved in US by the FDA to treat the disease itself. And these are called like aducanumab and lecanemab. That these are antibodies that attach to the amyloid plaques that are in the diseased tissue. Uh, the thing is, like, they just been approved, and their efficacy is not very well being shown that they work very well. So we just need to wait and watch, and it might take some more time that these two drugs will be approved in India.